We've just heard how this criminal system has failed to respond to this pandemic crisis. And as Mark said, unfortunately, we've seen this scenario play out before. We saw it in the government's disgraceful response to Hurricane Katrina in New Orleans in 2005, to Superstorm Sandy in New York in 2012, and in the lack of response to help the people of Puerto Rico when the island was struck by an earthquake or when fires raged in California in 2019. Each time, like today, there was a lack of coordination by all levels of government, with state and local governments waiting for federal aid that arrived too late, if at all. And instead of taking care of the people who were injured, displaced, and dislocated by the disasters, the majority of the aid ended up benefiting the corporations and the banks. When there was a response that made a difference, it was usually organized by ordinary people who rescued those in danger, found housing and shelters for those who were homeless, and got people needed medical services and food. But with the coronavirus pandemic, we face even bigger challenges. It's a long-term global crisis with no definite end in sight, and we can't even come together physically to support each other. So what can make a difference? First, we all have to act responsibly. That is, keep ourselves, our workplaces, and our communities safe and healthy. First, it means being aware of how the virus spreads, person to person. Just because we feel healthy doesn't mean that we're virus-free and can infect others. We all have to practice social distancing as a basic guide to our personal behavior, wherever we are in our communities and at work. Older and more vulnerable people need to stay home. That's a start, but we also need to understand what we're facing. And this is difficult because there was such a refusal to organize mask-free testing and centralize the results to provide accurate numbers of who is infected and how the virus spreads. The priorities of this society need to be radically reorganized and reprioritized. Essential services are those which guarantee the well-being of the population, not the well-being of real estate investors, banks, and corporations. In the current situation, healthcare is the top priority. When there's an urgent need, the resources of society must be directed to meet it, whether this is producing testing kits, personal protective equipment, medical equipment, or providing enough medical facilities. Adequate housing, food, and sanitation must be provided for all. The production and distribution of all essential goods should be coordinated locally, regionally, and nationally, and frankly, even internationally, to meet the needs of the whole population. And this has to take place regardless of citizenship status, who is unhoused, or who's in prison. Those working in essential services should have a major role in organizing and coordinating how care is given and how work is organized. And all those engaged in providing these services should receive testing and not work while infectious. The scientific community and healthcare providers must be in charge. They need to assess the evolving situation and coordinate the national healthcare response. To do this, they need current and accurate data. Who gets tested should be determined by epidemiologists and doctors, not politicians. Results should be both centrally reported and given quickly to those tested, followed by providing appropriate care. To coordinate this requires an accurate inventory of all hospital and medical facilities, an inventory of medical supplies and equipment, including what is held by the military and by non-healthcare agencies, plus an inventory of all medical personnel, including those working in non-healthcare settings. Retired nurses could train and act as mentors for new nurse grads to add to the number of nurses and be counted in this inventory. Manufacturing facilities can be quickly transitioned to produce and then allocate the resources where they are needed. First and foremost, we must protect the health and lives of everyone. There must be free and comprehensive screening and healthcare provided to all. Measures must be implemented to ensure the safety of workers in essential services. No one should be allowed to work who hasn't been tested and found to be healthy. Workplace health and safety should be supervised by healthcare professionals, not managers. Workers must be provided with all the necessary safety equipment. Workers must have the ultimate responsibility for their job sites and have the right to stop work if safeguards are not met. Childcare and elder care must be provided for those who must continue to work. All non-essential plants and other workplaces should be closed, but everyone should be guaranteed full wages, whether they are working or not. All schools and universities should be closed, but we need to make sure that students have childcare, food, and housing when they're not in school. What are some other necessary measures? An emergency public housing plan and shelters for all unhoused people must be developed. On the local level, there needs to be an assessment of housing needs and the availability of empty hotels, motels, and other buildings. These should be requisitioned to house the homeless. Outreach workers should create protocols for screening and treatment for those who are ill. An assessment must be made of all existing food providers like food banks. Then neighborhoods could provide food for people in need. Transportation and food delivery should be free. People should not go deeper into debt as a result of this pandemic. What we're suffering is bad enough. There needs to be a moratorium on rent collections and mortgage payments and a guarantee of no evictions or foreclosures for at least 6 months. All utility payments should be suspended and shutoffs canceled. No cell phone payments should be collected. All loan payments, credit card payments, and interest on loans should be stopped for at least 6 months. And I underline this, when the 6 months or whatever necessary period for quarantine is over, no one should be asked to pay back bills incurred while they weren't working. So what can we do now? There are ways for everyone to get mobilized and engaged. This is an opportunity to activate all levels of our society. We need to make sure that no one is alone and in need. We can't leave the people who are laid off or working remotely to languish at home feeling helpless. We have to give each other support. We can organize what you prefer, happy or unhappy hours, to meet with a drink of some kind on Zoom or Skype with family, friends, workers from our jobs, and our neighbors. We need to organize to stay safe and refuse to work in unsafe conditions. And this can be hard. At first, you may face resistance from other workers who either do not understand the seriousness of the crisis or who feel so worried about losing their jobs. But it's not a choice. We need to explain and argue with people that it's not a matter of whether you feel sick or not, because without knowing it, we can all be carriers and transmit this virus to those who are the most vulnerable in our homes and in our communities. As the civil rights movement song goes, we are the ones we've been waiting for. We have to be the front lines. In the US and elsewhere, we've seen workers stand up for themselves. Healthcare workers, bus drivers, auto workers, longshore workers, and workers at Amazon who've organized walkouts and protests and strikes when the bosses tried to force them to work in unsafe conditions. As I said before, neighborhoods need to be organized, and many have been using social media platforms to stay in touch and to provide groceries, medicine, and transportation to those in need. Groups have been organized around the country to take over vacant buildings, to provide immediate housing for those who are without shelter and protect people from evictions. Musicians, fitness coaches, art teachers, cooks, and many others have organized online programs to keep people together, amused, and diverted. This is what author Rebecca Solnit called a paradise built in hell. It's the mutual aid component of our organized resistance. When she wrote this, it was before this crisis, but she was referring to the efforts that ordinary people made during past disasters. Groups like ours are organizing discussions like this one, where we can share information and analyze the situation as it changes. We can and must discuss regularly what is going on, and we have to name who is responsible for the crisis. We also have to continue discussing what we can do to protect our lives, defend our interests and our future, and we have to stay connected. And as we do this, we can begin to imagine what we could do if we're even better organized and coordinated. And we need to understand our potential power. Coming out of this, and we will come out of this, even though it really doesn't feel that way right now, the world will have changed, and not for the better. Many will have died and gotten seriously ill, way too many. Tens of millions will have been out of work. Much of society may be at a standstill, But behind the scenes, those in power are already making their recovery plans. They've already gotten trillions of dollars, as Mark said, to protect their investments, but they're not going to stop there. Will they try to run the workplaces with fewer workers, violating work rules and safety? Will environmental protections be reduced? Will the transit cutbacks that have happened during the virus epidemic become permanent? Will schools remain closed or be transformed into charter schools? Will colleges and universities use the crisis to switch over to all online instruction? Past crises, unfortunately, have shown us what they have planned that could lie ahead, and we can't afford just to return to business as usual and make further sacrifices because of the massive mess created by those who run the society. We can't afford to passively refocus on the November elections and place our hope in the same old politicians that have failed us. The crisis has shown us who is essential to the functioning of this society, and it isn't those pulling down the six-figure salaries. It's what we have always known. Sometimes we forget. Everything that is produced, distributed, all the services, the transportation, the communication, and the education depends on the work we do. To prepare for what lies ahead, we have to be active today. We can make connections with new people and strengthen the connections we already have, building up and increasing our organized forces. There's a disease that needs to be eradicated from the globe if we are to protect our lives, ensure our future and the health of the planet. But it isn't the coronavirus. It's the capitalist system of the 1%, based on profit and greed. And it is those who do all the work of this society, the 99%, who have the potential power to get rid of this disease. Now I look forward to hearing from all the rest of you.